The notion that vaccines make you weak and sick is a misconception that has been debunked by scientific evidence, yet it persists in some communities, including some Christian circles. As a Christian, it is essential to approach this issue with a critical and nuanced perspective, considering both the biblical teachings and the scientific facts. In this essay, we will explore the claims that vaccines make you weak and sick, examine the scientific evidence, and discuss what Christians can do about it. Firstly, it is crucial to understand that vaccines are designed to protect individuals from infectious diseases by introducing a small, harmless piece of a virus or bacteria to the body, which triggers an immune response. This immune response helps the body to recognize and fight the disease, thereby preventing infection. The Centers for Disease Control and Prevention (CDC) and the World Health Organization have extensively researched and tested vaccines, and the overwhelming consensus is that they are safe and effective. Despite the scientific evidence, some individuals claim that vaccines make you weak and sick, citing concerns about vaccine ingredients, such as mercury, aluminum, and formaldehyde. However, these claims are based on misinformation and a lack of understanding of the science behind vaccine development. For example, thimerosal, a mercury-containing preservative, was removed from most vaccines in 2001, and numerous studies have shown no link between thimerosal and autism or other neurological disorders. Similarly, aluminum and formaldehyde are present in tiny amounts in some vaccines, but they are also naturally occurring in the environment and are not harmful in the amounts used in vaccines. Another concern raised by some Christians is that vaccines are made from aborted fetal tissue or contain animal products, which they believe is morally reprehensible. However, this is not entirely accurate. While it is true that some vaccines, such as the measles, mumps, and rubella MMR vaccine, were developed using cell lines derived from aborted fetuses, this does not mean that the vaccines themselves contain fetal tissue. Additionally, many vaccine manufacturers have developed alternative methods that do not involve the use of fetal tissue. So, what can Christians do about the misconception that vaccines make you weak and sick? Firstly, it is essential to educate themselves about the science behind vaccines and the biblical teachings on health and wellness. Christians can consult reputable sources, such as the CDC, WHO, and the American Academy of Pediatrics, to learn about the safety and efficacy of vaccines. They can also engage in respectful dialogue with healthcare professionals, scientists, and other Christians who support vaccination. Secondly, Christians can promote a culture of compassion and care for their neighbors, particularly those who are vulnerable to infectious diseases, such as the elderly, young children, and people with compromised immune systems. By getting vaccinated, Christians can help protect these individuals and prevent the spread of diseases. This is in line with biblical teachings, such as Leviticus 19:18, which commands us to love our neighbors as ourselves. Thirdly, Christians can support organizations that promote vaccine development, distribution, and education, particularly in low-income countries where access to vaccines is limited. This can be done through financial donations, volunteering, or advocating for policies that support global health initiatives. By doing so, Christians can demonstrate their commitment to caring for the poor, the sick, and the marginalized, as taught in Matthew 25:31-46. In conclusion, the claim that vaccines make you weak and sick is a misconception that has been debunked by scientific evidence. As Christians, it is essential to approach this issue with a critical and nuanced perspective, considering both the biblical teachings and the scientific facts. By educating themselves, promoting a culture of compassion and care, and supporting global health initiatives, Christians can play a vital role in promoting public health and preventing the spread of infectious diseases. Ultimately, by trusting in the wisdom of God and the scientific evidence, Christians can confidently support vaccination as a means of protecting themselves, their loved ones, and their communities.